Alright, here we have a sphygmomanometer. We've got the bulb that puts the air into the bladder. To control the airflow, we kind of have a valve which will allow the air to escape. You'll hear it make a whistle, or it can block off the air. We also have a gauge which will help you determine the pressure of it. Here's our stethoscope. The three main parts: we've got the chest piece, we've got the tubing that comes along with it, and then we got the headpiece. One main thing to remember about the stethoscope is that when you're going to wear it, you're going to want these to aim towards your face in order for it to properly hear. Alright, here we have an aneroid sphygmomanometer, and we have a mercurial sphygmomanometer. This one's filled with mercury, so it's based on the fluidity, and it makes it more accurate. This one is more mechanical. It requires a little more calibration, while this one doesn't need to be touched. Now, this one's a little more expensive, and this one's a little more common, therefore cheap. If you drop this one, it can be a little dangerous. You'll spill mercury everywhere, while this one is going to be a lot more safer to use. Alright, have you rested 5 minutes prior?
I have.
Alright, take your blood pressure. Now, I don't want this to overcuff you, which means this cuff is going to be bigger than your arm, because it'll give me falsely low readings. And I don't want this cuff to be too small, which is undercuffing, and it'll give me falsely high readings. Give me enough room here so I can get to your arm. You're going to want this artery mark lined up with your brachial artery. Put the chest piece in your brachial artery. Your normal blood pressure, 120/80. Alright, so a few extra things. The proper technique once you have your patient, his arms are level with his heart and his feet are apart. How high do you pump? Well, you're going to pump about 20 to 30 over what you expect their blood pressure to be. How fast or at least do you do on the valve? You're going to do about 2 to 3 milliliters per second, which is very slow. Some other things we'll need to know is the units for blood pressure. We're going to measure in millimeters per mercury, mercury being this Hg value. The difference between systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the pressure in your arteries during the heartbeat, and diastolic blood pressure is the pressure in your arteries in between heartbeats. How they're represented: systolic blood pressure is going to be the first sound you hear when you take blood pressure, and diastolic blood pressure is going to be the last sound you hear when you're taking blood pressure. And then you'll get your overall value, which is systolic blood pressure over diastolic blood pressure. For example, 120/80, which is normal blood pressure. You're going to be listening for the Korsakoff sounds, which is the sound of turbulent blood flow, which is going to make the... Alright, here we have the table of the different levels of hypertension. Below 120/80 is normal blood pressure. 120/80 to 139/89 is pre-hypertension. 140/90 to 159/99 is a stage 1 hypertension. 160 and above over 100 above is stage 2 hypertension. Now, a few terms to remember: we have hypotension, which is anything below 90/60 blood pressure. We have white coat hypertension and masked hypertension. The difference between the two is that white coat hypertension, you will have higher blood pressure in a clinical setting, and then just a normal blood pressure in an outside setting. While masked hypertension is a normal blood pressure in the clinical setting, and then a higher blood pressure when you're out of the clinical setting. The importance of this: well, blood pressure can be a silent killer. If you have too much pressure in your arteries, it can cause you to have a heart attack or maybe even a stroke.